We begin with the topic 1, Introduction to Psychotherapy. This foundational topic will help us understand what psychotherapy is, where it originated, who benefits from it, and how the therapeutic process actually unfolds. Think of this as your map before we dive into the territory. Let's explore the world of talk therapy together. So, what exactly is psychotherapy? As its core, psychotherapy is a collaborative treatment, a structured relationship between a trained therapist and an individual, grounded in scientific psychological methods. It aims to bring about meaningful positive changes in how a person thinks, feels, and behaves. Three pillars define it. It is scientifically grounded in research and neuroscience. It is collaborative, meaning therapist and client work together as partners. And it is holistic, addressing thoughts, emotions, behaviors, relationships, and life circumstances all at once. Psychotherapy has a rich history spanning over 140 years. In the 1880s, Joseph Breuer's Talking Cure with Anna O laid the first stones. Sigmund Freud then built on this in the 1890s with psychoanalysis and reducing the unconscious, repression, and free association. The 1920s brought the behavioral revolution with Watson and Pavlov. By the 1950s, Carl Rogers and Abraham Maslow championed humanistic psychology. The 1960s gave us Aaron Beck's cognitive therapy and Ellis REBT. By the 1980s, CBT became dominant and integrative evidence based approaches emerged. Each era contributed tools we still use today. Five core principles guide ethical, effective psychotherapy. First, the therapeutic alliance. The relationship between therapist and client is the single strongest predicator of success. Second, confidentiality. What you share stays protected, creating a safe space for honest dialogue. Third, non judgmental acceptance. Therapists offer unconditional positive regard, enabling deep exploration. Fourth, empowerment. Good therapy builds the client's own capacity to navigate life independently. And fifth, evidence based practice. Interventions are grounded in science and adjusted based on measurable progress. These principles are not optional extras, they are the soul of the work. Who can benefit from psychotherapy? The answer is far more people than most realize. On one hand, it effectively treats diagnosable mental health conditions like depression, anxiety, PTSD, OCD, bipolar disorder, eating disorders, and substance use disorders. On the other hand, it serves those navigating life challenges, relationship conflicts, grief, career transitions, trauma recovery, self esteem issues, parenting stress, and personal growth. Psychotherapy is not just for those in crisis, it is for anyone who wants to understand themselves better and live more fully. Psychotherapy is not a single approach, it is family of related but distinct methods. Psychoanalytic therapy explores the unconscious and childhood roots of behavior. CBT targets and restructures negative thought patterns. Humanistic therapy emphasizes self actualization and empathy. Integrative approaches blend elements tailored to the individual. Systematic and family based therapies address relational and cultural contexts. And mindfulness based cognitive therapy combines meditation with cognitive tools to prevent relapse in depression. Each approach has its own theory, techniques, and evidence base, and therapists often draw on more than. Psychotherapy is delivered across a wide range of settings. Private practice offers personalized one on one care. Hospitals and inpatient units provide intensive therapy for acute crisis. Community mental health centers extend access to undeserved populations, often on a sliding scale. Online teletherapy removes geographic barriers through video, phone, or messaging. Schools and universities embed counseling in academic settings for students, and corporate employee assistance programs offer short term therapy to address workplace stress and burnout. The setting is chosen based on the individual's needs, severity of presentation, and available resources. Therapy unfolds in five identifiable stages. One is assessment, engagement, building rapport, and identifying goals. Stage 2 is exploration and insight, uncovering patterns and underlying dynamics. Stage 3 is active change work, applying evidence based techniques like cognitive restructuring or behavioral experiments. Stage 4 is integration and practice, applying new skills to real life and addressing setbacks. And stage 5 is termination and relapse prevention, reviewing progress, consolidating gains, and preparing to sustain change independently. These stages are not always linear, but they provide a meaningful roadmap for the therapeutic journey. The field was shaped by extraordinary thinkers. Sigmund Freud gave us the unconscious defense mechanisms and free association. Carl Rogers introduced unconditional positive regard, empathy, and congruence as the heart of healing. Aaron Beck identified automatic negative thoughts and cognitive distortions as engines of depression. Albert Ellis challenged irrational beliefs with REBT, and Slavoj Mochin revolutionized family therapy by treating the system rather than the individual. And Marsha Linehan developed DBT, combining cognitive behavioral techniques with mindfulness to treat borderline personality disorder. These pioneers built the shoulders we stand on today. Psychotherapy is purpose driven. Its goals include symptom reduction, elevating depression, anxiety, phobias, and intrusive thoughts, improved coping skills, developing healthier ways to handle stress and life transitions, enhanced self understanding, gaining insight into personal patterns and unconscious drivers, relationship improvement, building healthier communication and attachment styles, behavioral change, breaking destructive habits, and building adaptive responses. And most ambitiously, increased well being, moving beyond symptom management to authentic flourishing, meaning, and purpose. Every session is designed with at least one of these goals in sight. How does psychotherapy compares to medication and combined treatment? Medication targets brain chemistry and it's effective while taken, but may not persist after stopping. Psychotherapy builds lasting skills and insight, making its effects more durable, especially for trauma, relationships, and chronic conditions. Combined treatment, psychotherapy plus medication produces the strongest, most durable outcomes for severe or complex presentations. The patient's role also differs. Therapy requires active participation and co creation, while medication often places the patient in a more passive role. For most complex conditions, the combination is the gold standard. A skilled therapist brings both personal qualities and professional qualifications to the work. Core competencies include active listening, genuine empathy, cultural competence, professional boundaries, ethical decision making, and commitment to evidence based practice. Professionally, therapists come from several backgrounds: psychologists with doctoral degrees, psychiatrists who can prescribe medication, licensed counselors, and social workers at the master's level, marriage and family therapists, and certified psychoanalysts. The common thread is rigorous training, ongoing supervision, and a deep commitment to the well being of those they serve. Research tells us what actually makes therapy work, and the answers may surprise you. 40% of outcomes are explained by extra therapeutic factors, the client's own characteristics, life circumstances, and social support. 30% comes from the therapeutic alliance, the trust and emotional bond between client and therapist. 15% is explained by expectancy and hope, the client's belief that they can change. And only 15% comes from specific techniques. This tells us that relationship, context, and belief matter enormously, often more than which particular technique the therapist uses. Several powerful myths prevent people from seeking therapy. The myth that therapy is only for serious mental illness. In truth, anyone facing stress, transitions, or growth can benefit. The myth that talking makes problems worse. Structured therapeutic exploration actually reduces the power of distressing thoughts over time. The myth that therapists just listen and say nothing. Modern therapists actively teach skills and challenge unhelpful thinking. The myth that therapy goes on forever. Many effective treatments are completed in 8 to 20 sessions. And the myth that medication alone is enough. Combining therapy with medication produce significantly better long-term outcomes. To summarize lesson 1, psychotherapy is a scientifically grounded, collaborative process that helps individuals change thoughts, emotions, and behaviors. It has over 140 years of history from Freud to modern integrative approaches. Multiple types of therapy exist, each studied to different needs, with the therapeutic alliance as the strongest predicator of outcome. It benefits a wide range of people from those with clinical disorders to those seeking personal growth. Common myths are barriers to help seeking and must be actively addressed. And the field continues to evolve with neuroscience and technology expanding its research and effectiveness worldwide.